When insulin is ordered, you have to be absolutely sure. You have to double check and triple check. You're using the correct route, the correct type of insulin, the timing of the dose, and the correct dosage. There's several different types of syringes out there. Make sure you're using the right one. And insulin dosage and insulin order and the prepared dosage are always second checked by another nurse. Do not give it unless you've had somebody else verify with you. We're checking blood sugar level before giving insulin. Rolling the vials between our hands instead of shaking them to mix the suspensions. Ensuring that correct storage of insulin occurs. It's normally kept at room temperature except in very hot environments. We're only using insulin syringes. And we are ensuring that we are coordinating these with meals and giving them at the correct time and in combination with the meals. When drawing up 2 types of insulin in one syringe, always withdraw the regular or rapid-acting insulin first. Provide thorough patient education regarding self-administration of insulin injections. Oral anti-diabetic drugs. Always check blood glucose levels before giving them, and most of them are given 30 minutes before meals. However, there are a few exceptions, as you can see on this slide. All right, what do you do if hypoglycemia occurs? Well, you got to look at the whole situation. If you're someplace where you don't have any other food immediately available, we're going to give them glucagon, or tell them, take your glucagon. Carry some hard candy with you. Corn syrup, honey, a non-diet soft drink. But you don't want a whole lot. Remember, it's going to take you maybe 20 minutes for this situation to completely resolve. And sitting and waiting for that food to hit the bloodstream is nerve-wracking. If you walk in the room, they're having these signs and symptoms, and their food tray is sitting there and they haven't eaten yet, well, have them eat their meal. Don't give them this other stuff. Just give them their meal. Have them eat their meal. That's going to provide a better combination of proteins, carbohydrates, and fats. And again, we're monitoring their blood glucose levels. We're doing it before it's best if you can do it before you do any of these other interventions. Verify that it really is hypoglycemia you're seeing. And then afterwards, you want to be checking it several times afterwards. Remember, rebound hypoglycemia? So we're going to keep checking their blood sugars. We're going to monitor for therapeutic results, which means we're trying to keep their blood glucose levels as close to 100 as possible. We're watching their hemoglobin A1Cs, and we're watching for hypo and hyperglycemia. Normal blood glucose in a regular person without diabetes is 70 to 100. If we can get people with diabetes to be close to that, that's fabulous. Blood sugar that's between 110 and 126 is called an impaired fasting plasma glucose or fasting blood sugar, and that's prediabetes. And if it's above 126, that's diabetes. Fasting, we want people to be less than 110 milligrams per deciliter. What does fasting mean? It means they haven't had anything that has any kind of caloric content in it at all for at least 8 hours. Preprandial, that means before eating. Doesn't mean it's been 8 hours now. It just means before eating, we want them to be 90 to 130. Postprandial peak levels, which is between 1 and 2 hours, is about 180. Excuse me, it's less than 180. And hemoglobin A1C, we want to be less than 7%.